Welcome everyone to part 1 of the Michigan Humane Society's TNR webinar. Our goal with this brief introduction is to provide you a solid grounding in the TNR process through Michigan Humane Society and how to get started as a feral cat colony caretaker. Following this training, you will receive supplemental materials including the TNR Handbook, a comprehensive guide to the MHS TNR program, a detailed list of surgical dates available to you, as well as how to schedule surgery for your cats, an instructional sheet that explains how you can become a member of the MHS Feral Cat Facebook page, which will connect you with other colony caretakers and provide you with additional resources to keep your colony safe and healthy. This webinar is by no means exhaustive. There is a multitude of research and information available to you from other organizations as well. We encourage all of our colony caretakers to do their own research on methods and best practices for their individual colony. The Michigan Humane Society should not be your only resource, but we are happy to set you on the right path. What is TNR? TNR stands for Trap, Neuter, Return. The TNR program through the Michigan Humane Society was created to support feral cat colony caretakers. A caretaker would be any person who manages a colony of feral cats by providing them with the basic needs of all animals: food, shelter, and access to clean water. Some cats are able to live successfully outdoors, ideally with a little help from caretakers. The other alternative for these cats would be humane euthanasia. In order to prevent that from happening, we want to set these cats up for success in their current environment, which means making sure all their basic needs are met. Not all cities permit a TNR program within their jurisdiction. Some cities may only permit a modified version of the program, and still others may not say anything at all. It is your responsibility as the colony caretaker to ensure that you work within the city's guidelines at all times. You do have the option to approach your city with TNR information, best practices for handling cats, and research to back up your position. However, you must abide by your city's decision regarding TNR programs, and the Michigan Humane Society is not able to advocate on your behalf to your city. Program benefits. What exactly does the MHS TNR program offer its participating caretakers and their cats? All cats will be spayed or neutered. Every cat will have their left ear tipped to identify them as belonging to a colony, as well as that they are already spayed or neutered. The Tomahawk Carrier Company offers discounted live traps to participants in the MHS TNR program, additional learning materials to help keep your cats safe and healthy, caretaker communication options, where you can connect with other caretakers in your community and share your stories with each other. Let's take a moment and define some of the terms that we will be using in this web series, as well as in future communications. Feral cat, a cat that is wild and lacks the necessary social skills to adapt to home life with a human. A feral cat caretaker is a person or persons who are responsible for the care and management of a particular colony. They provide food, water, shelter, and appropriate medical care as needed. Colony, a group of 2 or more cats, including moms and babies, that share a common feeding or sheltering area. Managed colony, a colony that is cared for by a human, the feral cat caretaker. Stray cats are cats that do not have owners. However, not all cats roaming outside are strays. Some cats live as indoor-outdoor cats and do have owners. Stray cats should be taken to your local animal control or municipality. Vacuum effect. When feral cats are moved from their environment for relocation, new cats will move into that territory and begin the breeding process all over again. The TNR program emphasis on return aims to interrupt this cycle by sterilizing the current cats and not permitting new ones to move into the territory. Left ear tip. The tip is removed under anesthesia during the spay-neuter process for identification purposes. A healthy feral cat colony. Each colony caretaker is expected to follow these guidelines to ensure that all of the cats in your colony are appropriately cared for. All cats are to be spayed or neutered. Surgery can be scheduled starting at the 4-month mark. All cats will be ear-tipped as part of their spay-neuter process. Each cat in the colony needs to be vaccinated for rabies, which is part of the reason for the 4-month-old time frame. Cats under 4 months cannot receive the rabies vaccine and would need to be brought in on a separate visit. Each cat needs to be provided with fresh food and water every day. Every cat in the colony needs adequate shelter from all weather conditions. Existing shelter, such as a back deck, is fine, or you can provide custom shelter options for them as well. Make sure that all shelters are well insulated and are cleaned and sanitized frequently. Feral cats need to be monitored by their caretaker for signs of injury and illness. Since a thorough exam is usually not possible, watch for changes in physical appearance, limping, wounds, weight loss, or changes in eyes. You may need to make a decision about seeking out additional medical care for the cat if these issues do not resolve on their own. Care and management information. Fresh food and water should be provided for your colony cats every day. Dry cat food is preferred in almost all instances, with each cat receiving approximately 1/2 cup every day. Dry food is more cost-effective, bug-resistant, and has all the nutritional benefits your cats will need. Wet food is great for baiting your live traps with, but since it freezes in the winter, attracts bugs the rest of the year, and isn't great for their teeth, we don't recommend a steady diet of it. Water needs to be in plentiful supply, particularly in the hot summer months. In the winter, check dishes frequently to make sure they haven't frozen. Always keep an eye out for any debris that may have fallen into the dishes and clean them frequently. Cats should be fed at the same time every day, and food should be left out for only 30 to 45 minutes each time. We recommend providing the cats with a feeding station, which contains both food and water, and surrounding the dishes with food-grade diatomaceous earth. Further information on feeding protocols can be found in your TNR handbook. Once you have all of the elements of your colony in place, your focus can then shift to the care and maintenance of your cats. As discussed in the previous slide, shelter for your cats can be basic or complex, depending on the needs of your colony. An easy and cost-effective way to ensure adequate shelter for the colony would be to utilize Rubbermaid tubs. Instructions can be found in your TNR handbook. Take the opportunity to observe the condition of your cats each time you head out to feed or clean. Remember to keep an eye out for obvious signs of injury, as well as the condition of their eyes and fur. Changes in the areas can signal a larger health problem and may require follow-up care. New additions to colonies do happen from time to time. Make sure to keep an eye out for new arrivals and trap them as soon as possible so they can be sterilized and ear-tipped. Sterilization for all colony members is the most important thing. You cannot settle completely into routine colony maintenance until all members have been sterilized and ear-tipped. Keep all records associated with your animals in a handy place. MHS will provide proof of rabies and sterilization at the time your cats have surgery. In the event that one of your colony members goes missing, you will need documentation as their caregiver in order to reclaim them from a shelter. Your health and safety is of utmost importance to us, so we urge you to take the following precautions when caring for your colony. Feed during daylight hours whenever possible. Wear appropriate shoes and watch your step. Always be aware of your surroundings. If your colony is not at your home, make sure to park in a safe and legal location. If you are working with your cats and notice a sick cat or kitten, take appropriate precautions. Make sure you are not handling the animal any more than necessary. Wash your hands and change your clothes prior to interacting with your own pets. And if you must bring the cat in for medical attention, transport only using a live trap. It is safer for both you and the animal. Above all, make sure to use common sense when interacting with your colony. A zoonotic disease is one which can be transferred from an animal to a human, either through a scratch or a bite. If you are ever scratched or bitten by one of your cats, clean the wound and contact your doctor immediately. Toxoplasmosis, a parasite transmitted through contaminated cats or their feces, usually has mild flu-like symptoms but can be fatal to the fetus of pregnant women. Cat scratch fever. It's a bacterial infection transmitted through a bite or scratch. A bump or blister at the site of injury is followed by fever, fatigue, headache, and/or swelling of the lymph nodes near the injury site. Rabies, a deadly viral infection spread through infected saliva, through bite wound or broken skin. The virus travels from the injury site to the brain, where it causes swelling or inflammation, which leads to a variety of nervous and physical symptoms. Tetanus, an infection of the nervous system spread through spores entering the body through an open wound. Symptoms begin with mild spasm of jaw muscles, known as lockjaw, neck, back, and/or abdominal muscles. Excessive sweating may occur. One of the most important aspects of feral cat colony management is making sure you're building positive relationships with members of your community. Take the time to explain to your neighbors about feral cats and what your role is as the colony caretaker. You are providing food, water, and shelter for the cats, in addition to making sure all of them are spayed or neutered, which will help control the number of feral cats in your neighborhood. It also cuts down on behaviors associated with breeding, such as spraying, yowling, roaming, and fighting. You can reassure them that feral cats pose little to no threat to humans unless the human is in some way threatening the cats. Feel free to provide them with resource material should they have further questions. If your neighbors have questions or concerns about feral cats in their area, the following information may help ease some of their fears. Not everyone is as excited to have feral cats around, so don't forget that you are acting as an ambassador too. When dealing with people, remind them of a few key things. Children should never approach a strange animal on their own, and if they see an animal in trouble, they need to alert an adult immediately. Always wash your hands after outdoor activities such as gardening, and avoid touching the cats whenever possible. Cats are generally not great hunters of birds, so neighbors that are concerned about their resident songbirds don't need to worry. Feral cats are wary of humans as part of their nature and will only attack if they are feeling threatened. Many common concerns that caretakers have are highlighted here, and the TNR handbook will also address them. They include proper feeding setup, keeping cats safe and away from your neighbor's property, and how to utilize garden beds as litter boxes. Flea and tick prevention is something to discuss with your veterinarian at the time you are coming in for the cat's spay or neuter. Any product you use should be formulated specifically for cats, and your veterinarian can give you further guidance. Thank you for watching Part 1 of the TNR webinar. Please proceed with watching Segment 2, MHS TNR Program Information, at your earliest convenience.